Welcome to an introduction to the acute care of at-risk newborns, or ACORN, a Canadian program of neonatal stabilization. My name is Khalid Aziz. I'm a neonatologist at the Royal Alexandra Hospital in Edmonton, Alberta, Canada, and an associate professor at the University of Alberta. These slides were developed with the help of Susan White, ACORN instructor and nurse educator at the Janeway Children's Health and Rehabilitation Centre in St. John's, Newfoundland and Labrador, Canada. The purpose of this and following presentations is to give you, as healthcare providers, an introduction to the ACORN process, primary survey, and sequences using case-based examples. This series of lectures is not a substitute for reading the ACORN text, nor does it replace a full ACORN course. I would hope that after viewing these slides, you will better understand the nature of the program and be better prepared for an ACORN course. ACORN is the acronym for Acute Care of At-Risk Newborns. It may be considered the Canadian textbook of neonatal stabilization and a sequel to the Neonatal Resuscitation Program, or the textbook of neonatal resuscitation. In most instances, we would consider registration with NRP to be a prerequisite to an ACORN course. This is not a problem for learners in Canada, where NRP is the standard educational tool for neonatal resuscitation training. To accommodate jurisdictions with no standard neonatal resuscitation program, the ACORN does include a section on neonatal resuscitation, which is based on the International Liaison Committee on Resuscitation Guidelines. The ACORN program is designed for the training of neonatal healthcare providers in all levels of institutions. Here is a typical example of a baby who requires the attention of an ACORN-trained healthcare provider. This could occur in a level 1, level 2, or level 3 setting. There is an unexpected and precipitate delivery of a 36-week gestation baby in your center. Initial resuscitation, including drying and thermal management, is done by NRP-trained staff. They are providing free-flow oxygen, but the baby is grunting and indrawing and is under a radiant warmer. At 10 minutes of age, you are asked to assess this baby. What do you do next? The ACORN provides a roadmap for what to do next, in what order, and how. So what is ACORN and how does it help this baby? ACORN is a systematic framework that facilitates the identification and management of at-risk or unwell babies. It addresses clinical problems by establishing priorities and then integrating assessment, monitoring, diagnostic evaluation, and essential intervention. The ACORN program has a number of important objectives. It helps healthcare providers and their institutions to identify the at-risk or unwell baby, to systematically evaluate the baby, to develop a working diagnosis and begin specific treatments, and to identify and prepare babies who require transport to a referral center. All ACORN courses should include certain minimum content. Course participants in Canada should be registered with the Neonatal Resuscitation Program prior to taking the course. Participants and their institutions should have completed a needs assessment which determines course content. Participants should pre-read the ACORN textbook. It would be worthwhile noting that the appendices are optional resources. Courses should be designed to reflect the interdisciplinary nature of neonatal care. Each course consists of an initial overview of the ACORN process, followed by small group sessions with case-based learning and interactive skill stations. At the end of the course, participants complete an evaluation of the course along with an evaluation of their instructors. As a caveat, ACORN is an education program that provides no exposure to real-life scenarios. Successful completion of an ACORN course does not equate to clinical competence, which is a professional and institutional decision. The ACORN program has 5 interrelated branches, which I'm going to briefly summarize. The ACORN textbook is a comprehensive resource for both learners and practitioners. The text includes information on both knowledge and skills related to neonatal stabilization, with an appendix to help with medications, procedures, and administration. Participants should pre-read the relevant chapters prior to the course. They are designed for self-directed learning. The textbook is also a valuable resource. It can be made available to a neonatal team when they are faced with an unwell or at-risk baby. Revenues from the textbook sales go to further development of the neonatal programs, of the ACORN program, through the ACORN Neonatal Society, a non-profit group dedicated to supporting and improving the program in Canada and abroad. The ACORN process represents 8 critical steps following identification of an unwell baby or an at-risk baby. Completion of the ACORN course requires an understanding of these steps. The ACORN process is a systematic approach to gathering information, establishing therapeutic priorities, and instituting appropriate interventions. It is applicable to both at-risk babies, for example, infants of diabetic mothers, and unwell babies, for example, those who have symptomatic hypoglycemia. This 8-step framework can be applied in many clinical situations by providers from a variety of backgrounds. This diagram summarizes the ACORN process. Steps 1 and 2 are identification of the unwell or at-risk baby, followed by an assessment of the need for resuscitation. Step 3 is the ACORN primary survey. This hexagonal algorithm summarizes a quick and easy assessment of the baby, identifying areas of concern according to the nature of the presenting problem. Step 4 reminds us that infections remain an important part of neonatal care. Step 5 is the creation of a problem list, listing areas of concern in order of priority in preparation for a more detailed evaluation and more focused interventions. Steps 3 to 5 should only take a minute or 2 to complete, and may be repeated at regular intervals, making sure that the baby's needs are being addressed. Step 6 requires the team to enter what is called the ACORN sequences, doing so in the order proposed by the priority list or the problem list. Each ACORN sequence is described by a clinical algorithm structured to facilitate rapid and effective care of the unwell or at-risk newborn. Each ACORN sequence is explained in its own chapter in the ACORN text. Step 7 reminds us that stabilization often requires consultation and subsequent transport to another center, while Step 8 reflects the importance of supporting all individuals concerned, the baby, its parents, and other members of the healthcare team. Steps in the ACORN process can be documented using copies of the primary survey and sequences. Some of the 8 steps in the ACORN process may occur concurrently, particularly if different members of the team accept different roles and responsibilities, but all are essential to safe and efficient care of the at-risk or unwell newborn. The third branch of the ACORN constitutes the pre-course assessment. This would be of the institution and learners. This is vital for preparation for an ACORN course, ensuring that instructors structure the course to address specified needs. In this way, learners can ensure that the course provides them with the knowledge and skills they need to stabilize a baby, and institutions can ensure that they provide the support services needed to deliver that care. The ACORN education program is the integrated system of training ACORN in your region, through which an outreach education program can organize and deliver courses at all levels of institution and provider. The education program reflects the regional nature of perinatal services in Canada, consisting of referring and referral centres. The program is supported by the ACORN Instructor Manual, the full text of which is available online to registered ACORN instructors, along with other teaching resources, such as updated ACORN sequences. Finally, for effective implementation, ACORN needs a provincial and national framework. This framework is evolving in Canada. The ACORN Neonatal Society is committed to successful implementation and maintenance of ACORN education programs across Canada. It also supports international initiatives that promote improved stabilization programs. The Society is in favour of a governance structure for ACORN that uses existing perinatal education programs. Now let us return to the case described earlier in this presentation. You are presented with a late preterm baby who is grunting and indrawing at 10 minutes of age. You are unable to withdraw supplemental oxygen as the baby becomes cyanosed. What do you do next? Of course, you initiate the ACORN process. Before you move on to the next presentation, I'm going to leave you with two important pieces of advice. The first by Yogi Berra, stating, if you don't know where you're going, you'll end up someplace else. And the second by Jean Kerr, if you can keep your head when all about you are losing theirs, it's just possible that you haven't understood the situation. ACORN-trained healthcare providers, when faced with an unwell or at-risk baby, will A, know where they are going, and B, keep their heads. I hope you enjoy the next presentations.